Hi, I am Dr. G. Rohit, the practicing psychiatrist. Today we will discuss about the autism spectrum disorder. The term itself denotes that it is the spectrum of disorder, spectrum of disease, and not a single disease. And first of all, we will come to a defining line of the autism spectrum disorder. Can be defined in the form that it is the persistent deficit in social communications and social relationships and social interest in multiple contexts, and this type of features are usually present in the early childhood, but they come to manifest only when they are being challenged to the social challenges which are out of proportion of their limited capabilities, and that is manifested in the form of the disease. These features are manifested in the form of the disease. There are certain three features that must be there, and other two associated features that must be there to make the diagnosis of the autism spectrum disorder. In the three essential features, number one is the social emotional reciprocity. The decreased social emotional reciprocity, they are not at all interested into making any relationship with the peer groups. They will not greet the persons. They are not interested to introduce themselves. They want to remain aloof, alone, do not want to make any relationships. So their social emotional reciprocity is very much lowered. Then number two, their non-verbal communication is also very poor. Either they are expressionless, their body languages doesn't speak anything, or if there is any expression, there is very of low magnitude. They are unable to make eye-to-eye contact, as well as there is very less coordination between the verbal and non-verbal communications. And number third, that they are having very least interest in establishing social relationships or maintaining the social relationships. They will not share their thoughts, ideas with their peer persons, their peer group. They will not engage in any imaginative plays with their peer persons. So they are not interested in making any social relations and not interested in maintaining the social relations. These are the three essential features that must be there. Then other features which I am going to narrate, there are four features, out of which two must be there along with these essential features. And these four features are stereotypy of the motor activity or speech, number one. Number two, immense resistance to change. And number three, restricted interest in few things. And number four, their hypo or hyperactivity to any stimuli, whether it is stimuli, it's the sensory stimuli. So out of these four, if two features are present, then it will make the full diagnosis of the autism spectrum disorder. Out of these four associated features, number one, we came to the stereotypy of the voices, stereotypy of the motor activity. They are engaged in the purposeless motor activity. Then number two was the immense resistance to change. They will not change their routine. They will stick to their routine. And if that routine is being changed, they will become panic. Then restricted interest in the few things. Only they are restricted, their interest is restricted to the few things only. The range of interest is very low. And number fourth, that either they will not respond or they respond out of magnitude of any sensory stimuli whether it is the voices, that is auditory, or whether it is the visual, that is any spinning object, or whether it is changing of the temperature, the heat or cold, the response is out of proportions, or there may not be any response. So all of these compiles, if we compiles all of these, then we come to the diagnosis of the autism spectrum disorder. Other features, other associated the aspects we will discuss later. Thanks for watching.